The position of the patient is very important. She should be in a semi-sitting position and bent as far forward as possible. The instruments used are a screw trocar for the laparoscopy, 3 5mm trocars, 1 15mm trocar for the introduction of the band, 2 standard windowed forceps, 2 pressure paddles, 1 needle carrier, and a thread passer. The Hager band has the following characteristics: an easy-to-use unlocking system, a fixing system based on a mechanical stop block with hydraulic assistance, a streamlined shape which makes the band easy to introduce at the moment of retrogastric dissection, a shape-restoring configuration of the implant to ensure maintained circular stomach support, a single-sized band which can be adjusted to a diameter of between 28mm and 16mm, a closure lock on the outside of the prothèse which provides complete coverage of the stomach by the atromatic pouch. The first incision is made 4 finger widths below the left costal limit. The screw trocar is introduced by eye. And then pneumoperitoneum is created to a pressure of the order of 14 kilopascal. The intervention is begun with an investigation of the abdominal cavity with particular attention to the size of the liver. A second trocar, the 15mm trocar, is then introduced in the left subcostal position. The slope should be slightly enlarged so that the reservoir can be accommodated at the end of the intervention. A third trocar, 5mm, is introduced in the left subcostal position, just external to the 15mm trocar. A fourth trocar, 5mm, is then introduced below the xiphoid process to be used to push the liver back. The last trocar, 5mm, is installed in the right hypochondrium. A foam pressure paddle is introduced using the subxiphoid trocar and positioned under segment 2 of the liver to push it out of the way and expose the hiatus region. The band is then introduced into the abdomen. The calibration catheter is positioned by the anaesthetist. Inflated with 15 milliliters of air and pulled back as far as the cardia. The first mark is made at the pars condensa of the lesser epiplon. The angle of S is then prepared and dissected by section of the phrenoesophageal membrane using a coagulation hook. An incision is then made in the pars flaccida of the lesser epiplon to expose the right pillar of the diaphragm. The final stage consists of making an incision in the pranogastric ligament just below the right pillar, below the decussatio. A windowed forceps is introduced so that it comes out of the angle of S. The catheter is recovered using the retrogastric forceps. Using mild traction, the catheter can be moved, but it should not be completely withdrawn, but rather left in the previously opened window. Next, the catheter is recovered via the small opening made in the pars condensa without damaging the fatty tissue of the lesser epiplon, or the anterior vagus nerve. Then the catheter is pulled so that the band automatically positions itself around the stomach. Next, the catheter is introduced into the lock. The calibration catheter is inflated, and the mild traction on the catheter and the band results in the fixing of the band under the gastric pocket. The final step involves burying the band by creating 2 or 3 sutures with non-absorbable woven thread. It is very important to create gastrogastric sutures. The sutures are created on the pouch, which is inflated so as to isolate the band properly under a small gastric pocket. The knots are made outside the body. The calibration catheter pouch is then deflated and removed. There is no point in installing a nasogastric catheter, and in our experience this is never done. The tip of the catheter is located and extracted in the 15mm trocar. The catheter is sectioned so as to withdraw the tip. The small silicon lock is slid through the catheter. The catheter is then connected to the reservoir and locked down. It is important to inject 3 milliliters of normal saline to ensure that the band is properly fixed in place. A small subcutaneous compartment is made and the reservoir is slid in unfixed. Here is what it looks like at the end of the operation after closure of the incisions. Here is an image recorded immediately after the operation with the band in the correct position. Here is a gastrograph showing the band in the correct position at the cardia. This image was recorded 1 month after the operation.